Hi everyone, my name is Nick Zupan, and I'm the epidemiologist with the Rock County Public Health Department. I'm here today to answer some questions that we received about data and the COVID-19 pandemic. One of the questions that we received is, what is a rate? What does it mean when COVID-19 is reported as a number per 100,000 people? The reason that we sometimes convert the number of cases to a rate is so that we can compare ourselves to other counties. We know that not every county looks the same, so we need to make sure that we have a way to compare apples to apples. For example, if we were to compare ourselves to Milwaukee County, right now we could say that we have about 300 cases and Milwaukee County has over 3,000 cases. So there are almost 10 times more cases in Milwaukee than Rock County. But we may also consider that Milwaukee has a much higher population, about 950,000 people. So they will likely have more because they have more people. When we compare our rates, Milwaukee County has about 340 cases per 100,000, and Rock County has about 194 cases per 100,000. By taking into account the difference in population sizes, we can have a better and more accurate comparison between these counties. Another question that we received is that on the Rock County projection page, it looks like the graph projects that there will be a certain number of cases on a certain date. But that date has already passed, and we didn't have that many cases. Why is that? The Rock County Public Health Department has been trying to model how the disease will spread over time based on the number of new cases that we've seen each day. Unfortunately, these models often rely on a lot of guesswork and aren't always 100% accurate. The models we have on our website at co.rock.wi.us are updated weekly, and you may notice that the projected number of cases of COVID-19 are higher than what was projected initially. First off, that's a good sign. That means that the model is likely overestimating how the virus will spread in the community and how many people will be affected. Also, our model is not going to be 100% correct. It will project the number of cases without taking into account local or state changes, and that's just the nature of modeling. We cannot predict everything that may change in Rock County based on the governor's orders or other rule changes. This model is intended to provide a ballpark estimate of the number of cases that could occur in Rock County. This information is helpful for healthcare and other partners planning for how we may need to respond to the disease. Another question that we've received is, what does it mean when we say negative test results? A negative test result means that a person was tested, and at the time that they were tested, they were determined not to have COVID-19. This, however, does not mean that they are immune to the disease. They could still get the disease at a later time. The Rock County Public Health Department reports the number of negative test results because some people may be tested more than once, depending on their doctor's recommendations. We've also gotten this question: what is an outbreak, and how do outbreaks impact our total number of COVID-19 cases in Rock County? An outbreak is defined as a number of cases being attributed to a single source or location in our community. Outbreaks can happen anywhere, but typically happen where there are many people working or living. Outbreaks can be a common occurrence in places like nursing homes and factories. When an outbreak occurs, we could have several new cases of COVID-19. Recently, due to a number of different outbreaks in Rock County and our surrounding counties, we have seen the number of cases for Rock County increase substantially. Finally, we received this question: how does increased testing affect the number of positive cases in Rock County? Recently, in Rock County, we've seen an increase in testing for COVID-19. Anytime we see an increase in testing, we will likely see increases in cases as well. That is one reason that we've seen an increase in the number of cases in Rock County in the past couple weeks. Ultimately, we would like to see the number of tests continue to increase, and as we work to control the spread of COVID-19, we hope to see a decrease in the percent of these tests that come back positive. So that's all the questions that we've received so far related to data and the COVID-19 pandemic. If you have additional questions, please send them to the email address listed below. Thank you, everyone. Stay safe and stay safer at home.